All right. Hi, everyone. I hope everyone's doing amazing today. Welcome to Mindful Nurses Wellness Wednesday series. My name is Claudia Wong. I'm a nurse practitioner and co-founder of Mindful Nurses along with Janelle Smith. We created Mindful Nurses to promote self-care and well-being for our fellow nurses. We know that nurses do so much to help others, and we wanted to make sure nurses were taken care of as well. We created the Wellness Wednesday series. So it's a series of talks and self-care practices from nurses and also holistic wellness practitioners to help encourage self-care and mental, physical, and emotional well-being of nurses. Today, we have a very exciting topic, transforming healthcare, prioritizing nursing well-being. So this is about employee wellness interventions within a healthcare setting. So this includes healthcare workers, including nurses. So these are some practical things that can be done within a healthcare system to help promote the well-being of nurses. So I'm so excited about this topic. And here to present is our Mindful Nurses member, Dr. Katelyn Erickson, Director of Nursing. She's a DNP and Certified Rehabilitation Registered Nurse. She works in Oregon in employee wellness, and she's going to talk about how to actually develop and implement interventions in the workplace. So without further ado, I'd like to pass it over to Dr. Erickson. Thank you so much for being here and educating us on this subject.
Well, first and foremost, thank you so much, Claudia, and to Janelle, and to the entire Mindful Nurses community here. This is just such an honor and a pleasure to be with all of you here today. Thank you for being here. Many of you are nurses. For those that are not, welcome. This is just a fabulous time and a historical time in history and in healthcare, in which we're all embracing and persevering through COVID-19 pandemic together. And it's really an honor to serve in a role that really honors the well-being of nursing and healthcare workforce. And so really, as Janelle Claudia had mentioned, that I'll be covering some opportunities of how health systems are beginning to really transform to focus on building a culture of well-being for our nurses and our fellow counterparts across the healthcare industry. We are trained so much as nurses to serve and to care for others, but rarely do we often think about caring for ourselves. And there's not a more time than now than to really begin focusing on that. And before I really take a deep dive into offering an exemplar of what I'm doing in my clinical practice, I'll just share a little bit of background about myself and my purpose and journey within nursing. So I've been in nursing for about 10 years. I've had the opportunities to work in different states in multiple clinical settings. I started in a transitional medical surgical unit where I got so much opportunities for diverse critical thinking, systems thinking, and individualized patient-centered care. So in addition to that, I also just love the opportunity to get more background in rehab, physical medicine and rehab nursing, where I took care of patients in cardiac, neuro, ortho care post-operatively. And that really drove me to thinking about how can we look at bringing our patients as well as ourselves into more of an optimal state of functioning that fosters well-being and just being our best selves. So we can get our patients discharged into communities where they live, they work, and they play. And in doing so, how do we also think about our own health as nurses and as healthcare providers? So with that experience in clinical practice, as well as a little bit in the hospice and palliative care arena as well, it really brought my heart and purpose with nursing on my career trajectory to think about more of an approach to whole person and whole systems of care. And in doing so, as I was exploring those opportunities, I found a unique doctoral nursing program at the University of Minnesota, a unique program that focuses on systems leadership with a specialty and emphasis in integrative health and healing. So where we can, as nurse leaders, begin to foster a systems thinking approach that really honors individualized whole person, body, mind, spirit, patient-centered care, but also think about integrative nursing principles that is inclusive of fostering nursing self-care, caring for the caregivers, that's us. And with that opportunity to go back and advance my education and really connect to greater purpose in my role as a nurse, and really think about systems transformation that fosters a culture of well-being. This is really the aim and the trajectory of where we can, as nurses, think about shifting the paradigm of healthcare delivery. That is prioritizing the well-being of ourselves. So that is, after grad school, that's actually what brought me out to Oregon. I serve in a healthcare system in Southwest Oregon, and really have the opportunity to be in a 1.0 position, that FTE role that really fosters the development, implementation, and sustainability of program development that really focuses on employee well-being. So I'm going to provide a little bit of an exemplar of different successes and barriers to the work. And maybe this will provide ideas for you as you think about how you can shift your healthcare system, even if it's at the department level, of ways that you can take ideas, take some highlights back to your practice for supporting the well-being of your colleagues, and even how this translates into your personal lives. So again, thank you for joining me and thank you for being here. Let's begin by just doing a recap of really looking at the critical systems issue of burnout in healthcare. There's significant body of evidence that suggests and validates that nursing burnout is a critical systems issue that needs to be addressed. And not only talked about, but really enacted on to mitigate and prevent burnout. And likewise, this is true for other areas of the healthcare workforce, particularly within nursing, that looks at compassion fatigue and moral distress. Especially during COVID-19, we're experiencing higher rates of moral distress and burnout. There needs to be a strategic plan in order to foster resiliency so we can keep going, so we can keep coping with and being open and adaptable to the ongoing changes during these turbulent and unprecedented times. As just a recap, if we think back to anatomy and physiology and looking at acute stress versus chronic stress, we know that with acute stress that this is a good, healthy inflammatory response, so we can act quickly and safely to bring ourselves and keep ourselves in a state of homeostasis. But what do we think about when we're more nursing and our interprofessional counterparts are experiencing chronic states of stress? Well, as we remember, we have an adrenal adaptation where we're releasing more cortisol. And when we're in these chronic states of high cortisol, this contributes to hyperglycemia. This contributes to other health detriment factors, including a pro-inflammatory chronic response, as well as weight gain, and how this manifests both emotionally and physically into other chronic disease processes. So again, when we think of chronic stress and ongoing burnout and compassion fatigue in our work, that it's time that we really prioritize and think about the well-being of ourselves and how we also think about this at a systems level as well. We often think of stress as a negative response. And I also want to encourage us to keep thinking of it as stress can also be positive when we're really thinking about it in a healthy way. We all connect to nursing as a purpose and a desire to care, to be servant leaders to others, to serve our patients, to serve our fellow colleagues, our families, our friends that rely upon us and inquire how we can address and help support their health and healing journeys. So let's stay connected to the positive opportunities that stress can bring as well. Stress is not always negative. What about that new job or a new baby? What about that new house you just purchased? There can be so many opportunities, but where do we find the balance so that we can always be present and check in with ourselves so that we're dealing and responding to stress in healthy ways rather than reacting? And going back to that anatomy and physiology, we remember that with systems biology that we're not operating in silos within these organ systems, but rather they truly are an integrated biological map of how we're working at the micro and the macro level of that whole person, body, mind, spirit, and how our bodies work in concert to constantly adapt to these cellular and macro responses to stress. Think about for yourself, what symptoms manifest both during acute and chronic stressors in your life? Think about the cardiovascular system. Oftentimes, the heart rate increases. Maybe we experience tachycardia, the blood pressure rises. The sympathetic response in the gut, our gut slows down, so we're not able to rest and digest food properly. Others, our muscles tense up. We have feelings and symptoms of anxiety. Therefore, our thinking and cognition isn't as clear. And when you think about these stressors that are inclusive when we're in a burnout syndrome or compassion fatigue over time, that when our body responds and tries to adapt, that this becomes extremely unhealthy over time. It's time to really think about how we can adapt and respond differently. So when we think about burnout and the critical systems issue, nurses are at the greatest risk, along with our counterpart physicians, at highest risk for burnout. We know that burnout, we hear it all the time, but it's important to recap. What are the key symptoms of burnout? See if some of these may resonate with you. And when you think about your work as a nurse during COVID-19, or whether maybe you're even a brand new graduate nurse, maybe you're coming into the field for the first time, all ready to begin your career, how can you think about mitigation and prevention of burnout? Wherever you are, whatever stage of your career, that all of this is applicable to whoever you are and wherever you're working in your clinical setting. Across the globe, nurses are at the highest risk for burnout. So some bullet points to think about when you are thinking about your work. Are you experiencing burnout or at risk for burnout? Some of the strongest indicators, and this is through the work of Maslow Burnout Index, a strong, valid, and reliable measuring tool to assess burnout for yourselves or within departments, or a system-wide measuring tool. This is valid and reliable. It's been implemented across different healthcare settings all across the world. So some of the greatest indicators that you identify so strongly with your work that all of a sudden the career becomes more important than other aspects of personal life, such as leisure, family and support systems, other entertainment, home projects, childcare. When your work becomes so much more out of balance than your personal life, this could be a strong risk factor. Are you working too much overtime or too much comp time? Are you working for free where you're staying late and not speaking up to supervisor and management that you're trying to keep up with your workload? This could be a strong indicator for burnout. So high workload. We talk about also if there's unclear job duties. Are you being pulled in different directions? Maybe a ton of collateral duties. Or are you staying in your swim lane of your exact position description and really clear with what your expectations are within your role? If not, this could also be an indicator for burnout. Think about your workplace culture. Think about it within the department that you work. Think about it within your system as a whole. Do you feel supported by your fellow peers at the front line? Do you feel supported by your supervisors and managers? And do you feel supported and well communicated with among your executive leadership team? This is one way to think about culture, not only through leadership support and peer support, but what other healthy activities are fostered within your work setting? Are you allotted your breaks? Are you intentional about taking your breaks? This is one key barrier, and we'll talk about that more of how we can be empowered to take some of these ideas and bring them back to your workplace. What about your professional relationships? Do you have a foundation of trust within your work areas? Can you rely on them when you have questions? When you need support with maybe indirect patient care? Are you offering safe practices and feeling like you have staffing matrices that are conducive for the safety and the quality? If not, these are cultural barriers that again can lead to burnout and we'd say moral distress in that situation. Think about your EHR and your charting. Are you spending more time directly with your patients? Or are you spending more time in your EHR charting? Where can you foster greater sense of present and a state of being with your patient throughout your shift? Others, depersonalization, where you're not feeling accomplished and accounted for, being really appreciated for the work that you're doing. Because nursing in the work that you do, know that you matter and you're so valued. You're so needed. We're in an era of a nursing shortage. So know that if you're not hearing it, you can hear it here, that you are so valued and you matter. And this is why your well-being matters as well. What about absenteeism? There's increased risk for absenteeism and calling in sick because of our mental and emotional distress related to burnout. Others to include our increased medical error when we think about high reliability organizations that think about systems change for zero harm, increasing patient safety, and not putting blame on the individual if there's a mistake that's made, but rather think of it as an opportunity for shifting the system and the process improvement. That would be another cultural factor. Do you feel like you feel empowered to speak up if you make a mistake? If not, this could also be an indicator for burnout. Ongoing stress. Do you feel stressed when you're coming on shift? Your shift hasn't even started. This could be another indicator. What about substance use and abuse? There's risk for nurses for diversion of opioids and other potential addictive medications for diversion. We'd like to see that decrease, but when there's increased use of these, higher risk, an indicator for burnout. And of course, we've mentioned higher risk for chronic disease. These can eventually lead to exiting the profession, as well as increased risk for SI and SA. There's emerging evidence that shows that we need to critically address these issues and syndrome of burnout, compassion fatigue, and also the critical need to prevent suicide, ideation, and attempt. So again, I've had such fantastic opportunity to be innovative in the role that I'm in right now and really begin to foster transformation that focuses on well-being across healthcare systems. And I'm going to share a little bit, go into a little bit of the programs that I've been developing as a means for intervention for addressing these systems issues for transforming healthcare and building resiliency within nursing and the healthcare workforce at large. It was really important, like with utilizing the nursing process, as you are with direct patient care and other clinical and non-clinical administrative roles, that we're always thinking about the nursing process, beginning with assessment. So when I came into the role about 18 months ago, it was really important before I took a deep dive in and really implemented integrative modalities for our employees, that I really took a step back to really observe and to deeply listening. What is going on at the department level and what's going on at the systems level that is maybe needed for transformation and needs of the unique organization. And so in doing so, I sent out a Survey Monkey, which was kind of my platform for getting a stronger understanding, both a qualitative and a quantitative approach for just learning what employees across the system and at all levels, at the frontline, management, and leadership levels, executive leadership levels, what's needed. Because I want to be able to meet each person and each department where they're at. I should probably note that this exemplar that I am providing, it entails a large healthcare organization, again in Oregon, but it also is integrated with 2 large outpatient clinics that focus on both primary and specialty care as well as mental health access. Inpatient care in the medical unit and the medical campus, and then 2 outpatient rural coastal clinics. This encompasses about 1,300 employees. And so it's really an opportunity so we can develop programs that really meet the needs for everybody in their unique ways. In addition to that, it was important to be able to provide access to all of the employees. So therefore, my schedule for the work setting was created in a way that gives access to these programs, whether the employees are working night shift, evening shift, or the day shift. And I'll get into more on how we designed platforms in order to facilitate. So giving some examples of different programs that have been successfully implemented, I'll give some of those. I will say that as nurses, we always have to be adaptable for change at any given moment. And I will say, as hard and stressful as COVID-19 response has been, that it's important to stay grounded and be curious and inquisitive to how might the next day bring. How do we stay present from one moment to the next? And in doing so, a lot of these programs were offered face-to-face, and utilizing not only myself as a program developer, but really within the needs assessment, learning about what employee well-being champions are out there, so that I'm not doing it alone. And as you continue to grow programs in your systems, that you also think about not being alone in the work. Really gather and create a tribe for those that are like-minded and ready, and also skilled, making sure that they're working within scope of practice to offer these programs. And we also work at evidence-based practice. If you're leading any evidence-based change, make sure that you're looking at strong literature review that ensures the latest evidence to bring in and translate this into your clinical work, whether it's for your patients and or your fellow colleagues. So to begin, I'm not going to be able to have enough time to go through all of these. We've got about 15 unique programs between myself and a lot of our employee well-being champions that are spread across departments and sites within the system, that we've been really able to spread and scale the work. And as I mentioned earlier, in response to COVID-19, we've had such opportunity to be creative and adaptive to bringing a lot of these programs to virtual environments, and therefore creating and leveraging greater access for employees to be fully engaged in participating and taking ownership of their well-being. To begin, it was really important that we also have a type of concept or a care delivery model that really fosters self-awareness, as well as components of lifestyle and self-care. So if you think about different components of self-care, some of these strong examples could be food and drink, making sure we're nourished and hydrated, quality of sleep to rest and recharge, spirit and soul. How do you connect to greater purpose and spiritual well-being beyond yourself as a whole being? Other examples could be relationships, that be with your colleagues, your families, and your friends, making sure you're feeling supported. Other areas include professional development, creating opportunities for ongoing continuous learning. And then there's other areas of lifestyle and well-being that probably you can think of. Thinking of power of the mind when we think about mindfulness and downshifting, a way of moving from the sympathetic response to the parasympathetic response, whether it's for 1 minute or multiple moments, that we can foster a sense of presence and stillness through any of these programs. They're currently designed, and I'll get into sharing some of these interventions, but they're also currently designed to ensure that nurses and our other fellow employees within the workforce are encouraged to take their breaks. So these are built on ways to take their half-hour breaks, to do lunch and learns, or drop in for a wellness session on their 15-minute breaks. They're also designed whether they want to create a schedule before or after work, that there's time built in for them to drop into a half-an-hour Tai Chi class or a half-an-hour Yoga Nidra class. And again, a lot of these are now offered online in response to COVID-19, but also we're finding great response and receptivity for greater access, so we can drop in and meet from wherever we are, whether on site at the hospital or clinic, or maybe working telework from home. So just to give some bullet points and examples, I'm just going to run down this list as ways of thinking about ideas that you're interested in, and then know that you can reach out to me and learn about how you might consider becoming certified, getting greater education for implementing some of these well-being programs and interventions into your facility. So to begin Yoga Nidra, we also offer a guided imagery meditation. Through the phone, we offer anonymous drop-in mindfulness sessions called Mindful Moments in the Workplace. We offer one-to-one employee well-being coaching. So we focus on lifestyle, personalized lifestyle goal setting through utilization of the SMART goal format. We also offer stress management drop-in sessions. We also look at the evidence on sitting is like the new smoking. So we offer overhead cues of taking mindful moments for desk stretch breaks. So nurses in their nurses station, those working in admin roles, they're cued overhead on the announcements. It's time to implement some mindful movement and mindful stretch breaks. So that's been a high success as we cultivate a culture of well-being. Others, we've got some very unique virtual platforms where we can have kind of virtual reality environments. We show up as our present selves on an online environment, but really creating kind of like a video game or virtual reality where we create avatars. And in those small group accountability sessions, we offer unique programs that focuses on functional anti-inflammatory nutrition and combining that with physical activity, fundamentals of fitness, and mindful movement. Another one that's been really successful when we think about sitting is the new smoking, that we want to think about stronger opportunities for moving. That be while you're charting or those that are working in call centers, that we want to be able to think about creative and strategic ways to move more at work. This could be also just by taking your breaks to taking a walk in the beautiful summer and different changing seasons, being adaptable to seasons and the power of nature for healing. But in addition, on the inside, in the hospital setting, we have seated ellipticals. So staff can participate in this pilot program where we've purchased seated ellipticals. They're called a QB. And we have friendly competitions on a web-based platform where we can have friendly competitions for people to measure their distance, their strides, their speed. And so that's been a really nice way to foster engagement and healthy well-being at work. In addition, we are a non-smoking facility, so we offer smoking cessation, nicotine replacement therapy free at cost, as well as smoking cessation health coaching. So we utilize both a pharmacological and non-pharmacological approach to whatever best fits the employee. In addition, we offer a lactation room, a healing environment for our nursing mothers. And as well as, I know somebody presented a beautiful presentation on cold lavender last session. And we have something similar that's called a critical incident stress management program. I'd love to begin fostering a cold lavender for our nurses. And right now, this is we have a critical incident stress management for any stressors that occur for employees, or maybe there's a patient crisis that affects the employees, that we want to be able to offer a peer support rather than therapy, that we stay within scope of practice and offer an evidence-based peer support program and curriculum. That's for both individuals and small group facilitated support systems. So those are some programs and interventions that we have implemented. And I welcome any questions that may come into the chat specifically on some of those. And then I'm gonna share a few more that are currently on hold, but also have been high areas of success within our system. One of them being Qigong and Tai Chi. Many of our nurses and fellow interdisciplinary counterparts have been through a Tai Chi for fall prevention and improving balance. And so we also honor that as a way of downshifting and relaxing the body through the gentle movement of Tai Chi practices. In addition, Reiki has been a strong opportunity for supporting employee well-being. It's been one of my favorite complementary and integrative health interventions as a Reiki practitioner myself. And those were especially highly receptive during our face-to-face in-person programs. And again, those have been our face-to-face meetings, and all of our programs are currently on hold. But we're looking to adapt and create a virtual environment to provide distance Reiki. And that's actually on our radar to begin expanding these programs. We have a labyrinth and a healing garden on site. That's been a really nice way of thinking about creating and fostering evidence-based healing and healthcare design. So we've got a beautiful, ample amount of green space in our area of Oregon. And then in addition to that, primarily dedicated for patients, but also accessible to employees as a vegetable garden. So then we can incorporate healthy teaching kitchens and thinking about local sustainability and cooking locally and offering education about functional nutrition and eating seasonally, utilizing functional nutrition through anti-inflammatory, minimally processed foods. So it's fun to grow our own veggies right on campus. We also have an employee fitness center that's currently closed right now in response to COVID-19 health promotion, disease prevention. But we're, again, encouraging employees to take advantage of all of our virtual programs, as well as ensuring they're getting outside to access the benefits of vitamin D during our summer days, and getting in some time for downshift, accessing green space, gardens, and getting out for walks during their breaks as well. We also offer, when we're also able to do group walking competitions, that we'd have a lot of fun with how many miles and steps people could get in, utilizing their own smartphones and other personal pedometers. That's been a nice way to foster health and well-being, and even improving engagement and job satisfaction when we're staying well. And lastly, but not least, we've had some really cool opportunities to bring in spiritual and indigenous healing practices through our intertribal council that offers sweat lodges. So those are a common traditional way of healing and bringing spirituality into healthcare through participating in sweat lodge ceremonies. And that's a nice way to detox our body, mind, and spirit, and a way of also building community and supporting the healing and wellness journey. There's been as well beyond, we know that healthcare happens beyond the borders of a healthcare system and beyond the borders of the four walls of a clinic. That when we emerge and engage ourselves in the public health sector as well, that health creation happens where we live, work, and play. So we as a system recognize that community is just as important as engaging and building a cultural well-being within a healthcare system. So when we engage with our counterparts in the public health sector, when nurses go home, that they have access to other lifestyle opportunities when they're off the clock as well. So if anybody has heard of Blue Zones Project, that is a big community well-being initiative that's taking place throughout various communities in Oregon, as well as 50 other projects happening in communities across the country. And so we're excited to partner with them as a community and as a healthcare system, and really foster evidence-based practice that really encourages longevity and health and happiness. We continue to work on building more healing environments within our staircases, even our restrooms. So when there's ways of building in nature to these areas on the staircase, or encouraging messages that foster well-being or areas of gratitude, that even when we're being mindful with our hand washing for infection prevention, that these are simple interventions that can make a strong impact. We know that when we address somebody by name, that they feel appreciated and supported, they feel heard. So there's extremely cost-effective and small interventions that can make a strong impact. There's been also evidence and TED Talks that talk about when you can make eye contact with anybody coming through the hallway, and then you smile at them when you get closer to them, that they feel more appreciated. And this is a way of fostering well-being and even greater kindness and satisfaction with our patients we serve, as well as our fellow colleagues. And before I close and open it up for questions, I just want to make sure that I highlight some of the greatest successes as well as barriers. As nurses, we always know that we're reevaluating and reassessing our interventions within that nursing process. So when I think about this work and this opportunity of being an employee well-being, of designing innovative new programs and systems transformation, I just wanted to share with you some of the key highlights for thinking about and offering for you as you consider designing programs at your facility. This could be within your department or across the system. And so some of the key takeaways that I've learned and evaluated for my programs is that one of the key takeaways is you really need buy-in from all levels of your organization. That's with our frontline care workers, nurses and beyond, all of our frontline workers. We know their increased risk for burnout. We know that they're currently tired, they're fatigued. The complexity of care is on the rise. And we've got an increased number of nurses in the baby boomer generation retiring. And we've got to build new strategies that are supporting us as well as our new generation of nurses coming in. So make sure we have buy-in. Let's start with these grassroots efforts on our unit-based practice councils, connecting with your peers of saying, what do we need to support ourselves and one another so we can be healthy? Likewise, this is true for management and supervisors. And this is one area that I find of greatest resistance. We need our managers and supervisors to also believe in and begin critically thinking about metrics that are going to be designed to support a culture of wellness within the department. And absolutely just as critical, we need buy-in from our executive leadership team. They are aware of all the performance metrics that foster patient safety, error, quality metrics, readmission metrics, chronic disease metrics. How are we creating improvement? Well, we've got to think about our employees. Are they engaged? What are their satisfaction rates? What are nursing turnover rates? And what are retention rates? So when we can build a business case as well as a clinical program design, these are really key pieces when you're starting to build and foster buy-in for your executive leadership. And then when they are bought in, making sure that they are engaged in participating in these integrative modalities, self-care modalities, that they're taking ownership as well. In addition, continue to reevaluate. Are you still meeting the needs of your fellow peers? What needs to be adapted? If engagement is low, what do we need to constantly improve? Make sure another key piece from what I found for success, again, is that you can't do it alone. Rather, make sure you have and stay in strong communication with employee wellness champions. Although they might be doing collateral duties, but see if you can find opportunities where they can partner with, grow and work alongside with, being creative and facilitating some mindful moments. Looking at opportunities to get certified in a yoga nidra training or other modality that there's interest in. And from there, with your champions, you're able to spread and scale your work at a greater capacity, so that then you're able to reach more and more employees. We know that nurses are in every area of a healthcare system. Therefore, nurses, we would argue, are the most well-positioned for these types of innovations and development in healthcare transformation. So they are working on every shift, they are working in every department. Truly, nursing is represented the most across our healthcare systems. And time again, we are the most trusted profession across healthcare. Let's continue to reinforce that in the work that we do every day. In addition, this is the year of the nurse. We are all well equipped and at a time of need to support our well-being. So let this be a strong opportunity for advocating to your peers, your managers, your supervisors, and your leadership that the time is now. I would also encourage as a success, if they're looking at metrics and you need to bring a business case for how this is supported, take a look at your baseline metrics of employee engagement, satisfaction, and if there's any way that you currently are measuring through all employee surveys at the system level, are there any indicators of burnout, compassion fatigue, or moral distress? These would be foundational areas to look at when you're looking at a quantitative approach. And then not to forget about barriers, knowing that with any of our work in nursing, in whatever practice, that we're always going to come up against barriers. And rather seeing these as weaknesses, think of them as areas of opportunity, of growth, curiosity, and being open to continuous learning and change. It's still embedded within our nursing culture that we're not very good about taking breaks. We often are working 10 or 12-hour shifts, hardly going to the bathroom. We might be eating while we're charting. But think about this for yourself. Are you taking your breaks? And what's a small area of change that you can think about? Small areas of change for yourself so that you can take care of yourself more at work. You are allotted and entitled to your breaks. See if this could be a starting place or an area of ongoing improvement for you. Will you have it built in as a habit for yourself? Begin to spread and scale that within your department. Begin to build a culture that says we're going to be starting to take our breaks more frequently. Another barrier was managerial support and buy-in. We know that managers and supervisors have so much of unique busyness and unique needs in staffing and operating a unit. And therefore, we've noticed that sometimes they can't always think about building well-being, that there's other metrics and other deadlines to meet. However, this is an identified barrier, but an area of opportunity of thinking about how do we really connect and be present with our nurse managers so we feel supported by them. Tell them how important it is to foster a culture of wellness. What are small activities that you can incorporate into your unit-based councils that leverage well-being? This could be getting rid of candy and donuts in the break room. Let's think of small, healthy replacements of replacing that with a veggie tray. One example to start with. Think about a deeper dive into the competing demands of work and personal balance. Are you working too much? Are you not spending enough time at home with those that you love? Getting your home projects done during COVID-19. Really finding that balance. We know that that's been an area of challenge within our employees right now. They believe in employee well-being, but after the shift, they've got to go meet the demands of family and other things at home. So we continue to grow in the opportunity of really taking personalized ownership for fostering kind of this whole person and whole systems approach to healthcare transformation. And lastly, as far as program outcome and evaluation, that it's really important to, when you're kind of making your case and building programs, you're going to want to make sure that you're tracking attendance. That again, you're looking at some of your strategic planning that aligns with your organizational goals. If you're looking to increase patient safety, increase patient quality metrics, increase employee engagement, that all of these well-being programs will impact the safety and the quality of not only our well-being and engagement at work, but also how this drives positive outcomes for patient safety, quality, and experience. And with that, I guess that concludes really my kind of exemplar of employee well-being, nursing well-being, and systems transformation. Thank you.
Thank you so much, Dr. Erickson. That was amazing. You covered so many different aspects of nursing burnout and system analysis of how employees are doing in terms of well-being and self-care. And the organization you work for, it sounds amazing. There's a farm, there's veggies growing, there's nature in different areas, and reminders to take little breaks and stretches, to name a few things. Sounds like a great workplace. Thank you so much, Dr. Erickson. We do have a question for you from one of our mindful nurses, Tabitha. I'll read it out loud for you. She says, I like the holistic way you are addressing mindfulness. What challenges have you faced or ways you have addressed this for employees telecommuting? I feel like telecommuting, I am doing almost twice as much work and having trouble setting boundaries with work.
Well, very good question. Thank you, Tabitha. And I just want to clarify, when you say telecommuting, are you referring to telework and working from home?
Yeah, she's working from home.
Okay, great. Yes, and that's such a great point as in our response to COVID-19 and thinking about shifts in how we think about healthcare operations, that we want to really promote health and really mitigate disease prevention in response to COVID-19. And so I would say that's likewise true with our system as it is with you, that telehealth and telecommuting has become more and more innovative in how we approach healthcare delivery during these unprecedented times. And I love your question, because that's been an area that we've looked at on the employee well-being side, as many of our nurses working in primary care, as well as other outpatient settings, and even our administrative healthcare workers that are now working from home. And so within our virtual settings, whether you're working from home or working from the hospital or clinic environment, that within our mindfulness practice, we've actually got an internal conference call line. And so employees, whether they're working from home or working from the hospital, that they have access to call in from anywhere on any phone to drop into these mindfulness classes. They're anonymous, or you can say your name and where you work from. So we create it all about them and where they want to drop in. Everybody's experiencing such unique stressors at this time that we want to honor being anonymous and confidential as well. If there's areas that they want to speak up with or offer a type of mindfulness practice that they want facilitated, we also welcome that as well. And then in addition, we know that time is limited. We've got busy, full workloads, that they are designed for 15-minute sessions we look at the evidence that even 15 minutes before starting a nursing shift, this fosters resiliency and setting the stage for a positive health and well-being shift, whether you're working from home doing telehealth or you're working in direct care on the floor.
Thank you. That's helpful. That's great that you guys have often those mindfulness sessions. How often do you offer them? A few times a day or a couple times a week?
Yeah, so they're currently offered within my schedule, working Monday through Thursdays. They're offered 3 times a day, Monday through Thursday. Yeah. And again, these are accessible even if you're not working on your shift, that maybe they're rotating weekends or holidays, that the employees can still call in during these timeframes, even if it's from their personal cell phone.
Great. Do you notice more engagement now that people are working from home, or less engagement since people are not on site in terms of participating in these interventions?
Sure. So it's so variable because it's often not disclosed as to whether they're working on site or from home. But there's been one thing that I didn't mention is that we have an internal marketing communications platform that goes through via email as well as on our SharePoint internal site. So there's a lot of platforms that are dedicated to our teleworkers that are feeling as though that they're tied to a computer all day, or they need different ways to be motivated to get up and move a couple times throughout the shift. But yeah, I think it's variable, and I think with more telework happening, that yes, we are providing greater access through these platforms.
That's really great. Wonderful ideas. Do you have any recommendations for resources that the nurses can look into? Like if they're interested in a career such as yours, you have a wonderful career where you can make an impact on the wellness of nurses and other healthcare providers.
Yeah, absolutely. So that's a great question as well. And I really have to give it to my alma mater at the University of Minnesota. There's a very unique program if anybody's interested in advancing their nursing education from a direct BSN or MSN to their DNP, Doctor of Nursing Practice. If you're looking at more of a clinical systems transformation, or just looking at a certificate in integrative health and healing, I would encourage you to visit the School of Nursing at the University of Minnesota online, and also through the Center for Spirituality and Healing at the University of Minnesota. You can look more at the work of Dr. Mary Jo Kreitzer and Dr. Mary Katelyn, one at the University of Minnesota and Mary Katelyn at the University of Arizona in Tucson. They really have been frontiers and global leaders in the work of integrative nursing and integrative health, and how nurses can be developed and so well positioned for this health systems transformation and bringing in self-care and integrative modalities into the workplace.
That sounds like great recommendations. Perhaps you can write it in the comment section so people can look those up. But
absolutely.
Thank you so much. It's been a very informative session and also very inspiring to see what kind of changes can be made in the workplace. I mean, it's also part of the nurses themselves to be accountable and recognize signs of burnout within themselves and make little changes that can turn into big results, and also look at all different parts of the system and gain buy-in from different levels of the system. So thank you so much for bringing this up.
Absolutely. Thank you, Claudia. And I can also provide, my email if there's any additional questions. I invite you to email me, and I'll provide that in the comments as well.
Wonderful. Thank you again. And thank you everyone for joining us on a Wellness Wednesday session. You can go ahead and share this video with other nurses you think might be interested, and stay tuned for our upcoming Wellness Wednesday sessions. Next week, we have a session on 5 tips to feel 5 times better. So tune into that and learn more. Thank you. Take care.